Hello viewers, good evening and welcome to your favorite medical show, Ask Dr. Saw. We're coming to you live every Tuesday at 8 o'clock and we ask you to share this information with your family and friends so they too can have access to information on their health and livelihood. Joining us this evening as usual is the man himself, Dr. Saw, who is in England. Dr. Saw, welcome to the show tonight.
Thank you, Akash. Thank you for having me, and for the viewers, thanks for tuning.
Wonderful. Dr. Saw, this evening we are talking about the thyroid gland, and I have quite a few questions that I would like to ask you about that. Of course, I know a few persons who would have, mentioned to me over a period of time that they would have had thyroid issues and they're suffering from different things. So I want to start by asking you this evening, what is the thyroid gland? Why is it important, and what are some of the functions of the thyroid gland? Please.
Very good question. And of course, lots of us know what the thyroid gland is, or we've heard of the thyroid gland. The thyroid gland is a very, very important gland in the body. And it is a gland that is located in the neck, is a butterfly-shaped gland in the neck. And it produces a hormone, or a chemical, let's say, called thyroxine.
Let's get the sorry, doc. Let's get the operator to put up an image of
the
please. Yes.
Let's have a look at the picture.
Right, it's up there.
It's up there, yeah. Okay, so you'll see on that picture on the neck there's that butterfly-shaped gland, and that is called the thyroid gland. Now it produces a hormone. So thyroxine metabolism is when you break down the food that we eat to produce energy. So think of it, without the thyroxine, we can't do that. Or if there is abnormality of that thyroxine or that gland, it affects our metabolism.
Right.
So it affects our ability to get energy. So you can understand the impact of that. So it is very important that the thyroid is functioning normally. And there are lots of problems that can go wrong with the thyroid gland, and I will break that down in a couple of minutes. But it is essential that we understand what the thyroid gland is. We know its function, so it produces thyroxine to control metabolism. And also, besides the gland itself in the neck that produces that hormone called thyroxine, it has what we call a feedback. So there's a controlling gland in the brain called the pituitary gland. Now that pituitary gland is in the body, we call it like the master gland. This gland in the brain controls lots of other parts of our body. So the pituitary gland produces a hormone called TSH, thyroid stimulated hormone. I just want to grasp this concept orally so people would understand, because when we talk, we will make reference to those values.
Right.
Now, the brain hormone controls the neck hormone. It's a little bit of a feedback. So you have a master gland in the brain.
Yes.
It produces thyroid stimulating hormone, and it sends a signal to the neck to produce thyroxine. And it's the thyroxine that controls the metabolism. So we can see that there's a little system in place how the neck or how the thyroid gland works.
Wow.
So that's a picture there. Not to confuse that there's another gland behind that gland, where you see that butterfly gland. There's another gland called the parathyroid gland, and that controls calcium level in our body. But we'll talk about that another day. So today we are focusing on the thyroid gland.
Wonderful. So I suppose there are many things that can go wrong with the thyroid gland. So I would like for you to break it down for us and the viewers here, Dr. Saw. What are some of the things that can go wrong with the thyroid gland, and how can we recognize that?
Well, it's a very simple way I try to break it down to people and to patients. So your thyroid gland is a physical gland, right? And something can happen. So it has two components, what is called a physical component and a functional component, like anything in the body.
Right.
You have a kidney, you have a physical kidney, and then you can have problem physically with it, like it's traumatized or there's a lump or something, and then you have a function where the kidneys filter the blood. Likewise, the thyroid gland has got it physically can be affected. So we'll come back to that. So physically, it can damage from lots of things. You can have tumors of the gland, you can have radiation damage to the gland, you could have trauma to the gland, you can have infection to the gland. So that's a physical component to the gland. However, they are not so common. The two commonest conditions of the gland is a function of the gland. And the gland can either function high or function low or normal. So when you're normal, it's functioning normally. So how do we know it is normal? We test the hormones called thyroxine and the thyroid stimulating hormone. So if all these hormones are good, we know that the gland is functioning well. If the gland is producing too much of hormone, that is called hyperthyroidism. Hyper, that is Hyper,
Yes.
is high thyroid.
Yes.
So it means the gland is producing too much. Now that's the problem. If the gland is producing too little, it is called hypothyroidism. HYPO.
Okay.
And it is producing too little thyroxine. So obviously, so we can then define, just looking at the function, we can say thyroid disorder, the two commonest conditions would be high
thyroid.
Parathyroidism or hypothyroidism.
Right.
Overfunction or underfunction. And I will just break that down. So I'll talk briefly on when it is functioning too much.
Yes.
And then we break that down. Then we'll come down to when it's functioning low. So let's talk about when it is functioning too much. Now they say, so that's called hyperthyroidism. So it means in essence, you're producing too much of this hormone. So you do a blood test and you see that the thyroxine is high. Usually, as I said, the signal in the brain is called the TSH hormone.
Right.
So so that signal sends a signal to the neck to produce thyroxine. So how do you know this? Well, on a regular blood test, you will see that the thyroxine is high, but the TSH is low. So
Okay.
let's just break this down a little.
Yes.
If this gland is underworking, the brain sends a signal, can you work? So that's called the TSH. It sends a signal to work. So the TSH goes up. Because sometimes patients get this confused. They say your thyroid hormone is high, but that means you're low in thyroid.
Right.
You understand?
Yes.
Because the brain hormone is high,
Yes.
telling the gland, can you work? And whereas the gland is low.
Right.
So that means you have low thyroid. But the brain hormone, which is called the TSH, is high. And vice versa, the opposite. When this gland is overproducing, the brain hormone decreases to say, hey, slow down. So when you know that you have low, so to know when you have high thyroid would be to measure the hormones. So if you have high thyroid, you'll see that the thyroxine is high. So they measure something called T3 and T4. These are the thyroxine hormone. T3 and T4, and the brain hormone is called TSH, thyroid stimulating hormone. So when you have high thyroid, you have high T3, T4, and you have low TSH. So that is called an overactive thyroid gland or hyperthyroidism. Now, how do you know you get it? So one is a blood test. So you can establish that from the blood test. But also there are signs and symptoms. And as I said to you, that the thyroxine is responsible for metabolism. So if you have overproduction, what happens? You have a high metabolic rate. When you have a high metabolic rate, what happens? We start to lose weight.
Yes.
We start feeling hot. You're burning energy. You're sweating. You're losing weight because the intention when we talk about weight loss, we're talking about how do we increase our metabolism to burn the energy so we don't gain weight.
Yes.
So in high thyroid, you lose weight, you start to sweat. So heat intolerance, you can't tolerate hot places because you're sweating a lot. You're anxious because you're a bit nervous. You may have tremors because the body is in overdrive. So let us put it that way, the body is in overdrive.
Right.
So you may have tremors, you're sweating, you're feeling clammy, it can affect other organs of the body as well. In some patients, they have bulging eyes. So some of the causes of, I will explain some of the causes in a minute, but there's something called Graves' disease where the body attacks produce thyroxine, and that also can affect the eye where your eyes are bulging. It makes you feel weak and fatigued and tired, and it can also affect your periods. So patients can have irregular periods or no period. Also, you can have diarrhea. So, so basically, high thyroid can affect almost, all the systems of the body. Yeah, so that's your synopsis. And some of the causes, the most common cause would be what is called autoimmune, where the body attacks the gland.
Yeah.
And that is called grave disease. So the body attacks it itself. So we don't know what triggers that, but it can run in family. There's a genetic predisposition, and of course there are lots of other theories about environmental factors and other causes. Also, you can have a nodule, like a lump, that is part of the gland now, is overproducing hormone. So the gland is that butterfly-shaped gland, and it's meant to be uniform, but one part can have a little bit of a lump, and it's producing excessive hormone. So that's called adenoma, toxic adenoma, we call it. You can also have high levels when you have an inflammation of the gland. The gland gets inflamed and it overproduced. In some patients, iodine, also excessive iodine, the gland, to produce thyroxine, you need a chemical nutrient called iodine.
Right.
To produce the thyroxine. So if you have excess iodine, that also could cause hyperthyroidism, and also certain medication, a drug called amiodarone, which we use for the heart, it can cause high thyroid. So that is your hyperthyroidism in summary. Also, the brain hormone can be excessive, so the conditions in the brain, pituitary adenoma, they can produce excessive stimulating hormone, and it can cause that. So those are some of the causes, but by and large, autoimmune, or where the body attacks the gland, that's the most common cause.
So based on what you just...
by adenoma, yeah.
Sorry, Doc. Based on what you just told me there, iodine seems to be a very important chemical in the body. How does one then ensure that you have the right amount of iodine, or you don't have does a deficiency in iodine cause thyroid issues?
Correct, it does, because iodine is needed to make thyroxine.
Brilliant.
So the gland got to get iodine to make thyroxine. So if you have low iodine, your gland will produce less.
Right.
So when I come to hypothyroid, the low one now, I'll tell you about the iodine. But indeed, let me just tell you quickly on iodine. If you have excessive iodine, which is very uncommon, we don't, unless we're taking some iodine supplement as an excessive thing. Most people don't. We take multivitamin, which has got the required amount of iodine in the body. And the threshold can be huge. I mean, your body needs, let's say, about 100, 150, or probably up to 200 micrograms. And they define it's only excessive when it reaches like over 1,000 micrograms. Okay. So, you have a wide range.
Right.
But the point is, iodine is very crucial for the function of the thyroid gland. And some of the things, where do we get iodine? We are usually not deficient, most people, because iodine is found in lots of iodized salt, so the salt that we use. They add iodine salt in them, that's how they make salt, so you have iodine. But you have iodine is rich in seafood, so shrimp and fish, dairy products, eggs. You don't have so much iodine in plant products. So the people who can be deficient would be vegans.
Right.
So they don't eat dairy, they don't eat eggs. So dairy, eggs have got iodine, seafood, seaweed. However, if you're vegan and you're not having any of the dairy and eggs and meat products and stuff like that, fish, you can be low in iodine. So iodine deficiency is common. Go ahead.
Right. So are there? But okay. So there are foods that you can. There are foods that we can use to increase the iodine in our bodies. But are there foods that we eat that can negatively impact on if you have thyroid issues?
Yes, of course. There's a family of vegetables they call cruciferous vegetables, and this is a family of broccoli,
Right,
cabbage,
cauliflower,
Brussels sprout, cauliflower.
yes, yes,
They can interfere with the iodine and the production of thyroxine.
okay.
So high levels of those. But of course, I mean, I haven't seen anybody, people eat that on a regular basis, but I haven't seen that as a result. I mean, hypothyroidism as a result of that. But I mean, these are the foods that can interfere with it. There are other soy products. Some soy products can do that as well. Cassava, of course, but the bitter cassava is a cyanide in the cassava that affects the thyroid production, the thyroxine production. But of course, you know, bitter cassava has got high cyanide, but the normal sweet cassava, you don't have so much. But of course, it still can have an effect. Those are some of the foods really that, you know, can interfere with your thyroxine. Let us talk about the commonest thyroid problem now, and that is called hypothyroidism.
Right.
So
the lower one, yes.
I said the two commonest would be low and high.
Yes.
High is not so common like low.
Okay.
Low thyroid or hypothyroidism is more common than hyperthyroidism. And they say it affects about 1 to 2% of the UK population. It's more common in women, about 10 times more common in women than men. Thyroid disorder generally affects about 20 million people in the US. That's, you know, some of the data that I've seen. So it is really, you know, it's not that uncommon. So low thyroid, what causes low thyroid? The body not producing enough thyroxine. And why does that happen? The thyroid gland itself can be affected. And again, like I said, with high thyroid, the body attacks the gland. It's called an autoimmune thyroid disease. In low thyroid, similarly, in the developed world, you have autoimmune disease as the most common cause. In the worldwide, iodine deficiency is the most common cause. So we talked about iodine just now.
Right.
So if there's a shortage of iodine in your diet, and worldwide, you know, that is the most common cause of low thyroxine or production of low or underactive thyroid. And of course, there are other causes like certain medication. Lithium, there's a drug we use for depression, and there are drugs that we use for viral infection. Interferon, quetiapine, there's an antipsychotic drug. Amiodarone as well, the cardiac drug I talk about. They can affect your thyroid cause hyper and hypo. So there are drugs that can affect the thyroid. You can have infiltration, certain diseases that gets into the thyroid gland. It can affect, like something called sarcoidosis, where you have how described, like fibrosis, granuloma we call it, of the gland. So anything that destroys the gland can make you have low thyroid. If you have inflammation of the gland, you can have high thyroid initially and then the low thyroid. And also patients who have had radiation of the neck. So we have seen lots of patients with cancer of the neck for other reasons. They have radiation and it damages the thyroid gland.
Oh, right.
So these are all reasons for you to have low thyroid. But by and large, commonly would be autoimmune and low iodine. Those are your common things. Now, how do we fix that?
Right. But I want to ask you also, Doc, about, before we go to fixing, a lot of times I would meet people and who had thyroid issues, and most times they had to go for a little surgery. They said they had a cyst. Is cyst a common presentation in
Yeah. So indeed, of course, I will tell you this from anecdotally, that is, if I look at some of my patients who have sent for ultrasound scan of the neck, so usually when I have an abnormal thyroid, for instance, function, so the blood test tells you the function of the thyroid, I would feel the neck to see if there's any lump in the neck. And if there's any lump in the neck, of course, that patient would need a scan. And the common scan we will do is an ultrasound scan of the neck. And even so, in certain categories of patients, once the thyroid is abnormal, I try to find the cause of the abnormality, and you can do a scan to see if there's anything going on in the gland itself. But if you have autoimmune thyroid, where the body attacks the thyroid, that's a blood, you see autoimmune markers in the blood. That can give you the diagnosis. But of course, doing the scan. So now, what tends to happen, if you were to pick people up on the street like that and scan their thyroid, you may find cysts in the thyroid. And majority of those cysts, they're not significant.
Okay.
I mean, our body has got cysts and lumps and bumps. They say 10% of scans would show lumps and bumps that are insignificant.
Okay.
And likewise, you can have cysts in the thyroid that are not insignificant. But when you scan the thyroid, normally the radiologist will send you a report, and they would say, they will classify the cyst. They classify it in 5 stages. They say U1, U2, U3, U4, U5. U1 is a normal cyst. U2 is a benign cyst, so it's not cancerous.
Mm-hmm.
U3 is what is say indeterminate or equivocal, neither here nor there.
Mm-hmm.
U4 is suspicious, and U5 is malignant, cancerous.
Wow.
So having a cyst in the thyroid itself is not a big deal, but if you scan, the radiologist, when they scan it and it looks suspicious or it looks cancerous, there are certain features of the cyst they will know. Now, if that is so, on the report it will tell you what classification you have got, then of course we can do so many things. We can stick a needle in it, take some samples, send it to the lab to see if it's cancerous. We can even take the gland out completely, send it to the lab, see if it's cancerous, and of course those are the ways. Or if it is not suspicious, or if it's U2, U3 kind of thing, you could say, all right, let me monitor this cyst. Let me repeat it in 6 months or a year to see if it is growing and if it's getting suspicious. So those are the things with the cyst. I think time
we're doing good with time. We're doing good with time. But okay, let me ask you this now about treatment. So if you have these issues, there are various categories, U1 to U5, as you mentioned. What are the various forms of treatment for hyper and hypothyroid? Those being the most 2 common types of issues that you would have.
Correct. Yeah. So hyperthyroidism treatment would be drugs. So we have options. You can treat with drugs. You can have an operation, or you could treat with something called radioiodine. Radioiodine is radioactive iodine that go and destroy the gland. Now, if the gland is producing too much, and first you would want to try, if you could give drug. Usually, drug and radioiodine, they're good first-line intervention, depending on the type of patients, because radioiodine is radioactive, so you don't want to do it to pregnant, patients and certain category of patients. But there are medication to block the production of thyroxine. So there are drugs for that. There's something called carbimazole family of drug, and they block the production of thyroxine. If the gland is diffusely overproducing and enlarged, you can have an operation, remove the gland completely. But remember, if you do that, then what you're doing, you're causing low thyroid, so you have to start treating for low thyroid.
Right, because the body needs to function. Yeah.
The body needs thyroid. So if I'm going to just take it away, I have to give you something to replace it.
Okay.
And also, as I say, radioiodine, you give that, and it burns the gland, for instance, sort of, and it destroys the gland, and again, you may have to give thyroxine. So that's for your high thyroid. For your low thyroid, you would give thyroid supplements. So thyroxine, common thyroxine is called levothyroxine. Mm-hmm. So you give in thyroxine supplement. And of course, when you give thyroxine supplement, you have to keep monitoring patients' thyroid levels. So if I start patients on thyroid, I will start them at a low dose if they're low. And if then I will test their blood after 6 weeks to see their level. So the level is usually monitored by something called the TSH, the brain hormone. Mm-hmm. So you want that brain hormone to be within the range. And the target, they say, is that you want it to be in the lower half of the range. So if you have a range, let's say 1 to 5, you want to be, let's say, from 1 to 2.5.
Right.
That's the target.
Yes.
Some people can be in the upper half of the target if they're asymptomatic, like they don't have symptoms. I forgot to tell you a bit about the symptoms. Quickly, let me tell you what symptoms of low thyroid. Yeah. So high thyroid, I say you lose weight, you're nervous, you're sweating, you're having palpitations. That's high thyroid. In low thyroid, you have the opposite. So you gain weight.
Right.
Your heart rate is low. Your pulse, if you check it, is very low. You're tired. You're fatigued. Remember, your body is not burning energy. Your metabolic rate is low. Your skin might change. You have dry skin, thickened skin. You lose your hair. And there's a classical sign in the textbook when you're at medical school. They teach you lose the eyebrow.
Oh, really?
Yeah, the eyebrow.
Right.
You lose your eyebrow.
Okay.
The thought of your eyebrow. So those are classic features. You feel cold. I talked about that. So you got all the opposite bits of what you would have in high. You get the opposite of low.
Okay.
And right, so the thyroxine management, we do that. And what else? You can also, if the thyroid, there are some people when they're low in thyroid, in iodine, for instance, the gland can enlarge to just compensate. So the gland is trying to work hard to keep that level at a normal level. So the gland just gets bigger and bigger, and that's what's called goiter.
Right.
So goiter is when you have a swollen thyroid gland.
Yeah, it's usually swollen across the neck here. I know people who had that. I know people who had that operation from many years ago. Probably one woman I know, she had it in the early 90s or late 80s, and she has this huge mark on her neck here. I don't know if the intervention has changed now.
So the goiter is an enlargement of the gland, but the goiter can be due to overproduction, as in hyperthyroidism, because if you have a nodule or part of the gland working too much, you get a swollen gland. Or if you have the gland is working a lot, but it's not producing enough, so your thyroid is low. Sometimes the TSH, the one in the brain, is telling the gland, can you work a bit hard? So the gland is trying to work hard, and it grows.
Right.
So either high or low can give you a goiter.
Right.
And in those cases, if the goiter is big enough, of course you've seen patients who have got big neck.
Yeah.
When it grows that way, it can press on your organs. It can even suffocate you.
Wow.
It press on your throat, your windpipe.
Yeah.
It can press on the blood vessel, the nerve, and it can cause so much of problem in the neck that most times, if it is big, and sometimes you don't see that forward swelling, but it is retrosternal, meaning it happened at the back.
Yes. Yeah. The mass is inside there.
You have to go. Yeah, you have to go and operate on it. So that's, in summary, thyroid. I mean, it is important for patients to understand. I think the intention of this is for patients to understand when do you check for thyroid. What is a thyroid? So we understand it can be a high thyroid or a low thyroid. And also you can have physical problem of the thyroid, like cancer of the thyroid and other diseases that get into the thyroid gland. And when to recognize it. Just quickly, just to close, there are a group of patients.
Right. I was going to ask you if there are specific people who, if this thing is hereditary, and if people can, if they need to be on the lookout for it.
Of course, yes. So certain patients I would screen. So sometimes, in our normal annual blood tests or a couple of years blood tests, you go in and have a general checkup. Lots of times we put thyroid as part of it. Because if I ask patients, anybody who's tired, if a patient comes to me and says, Doc, I'm tired, and I check everything and they're normal, they're eating healthy, they're exercising, they're sleeping well, I normally say, I can't explain your tiredness, so let's run some bloods. And of course, you want to check for anemia and vitamin deficiencies, but also importantly, you check for thyroid. If you've got unexplained depression, anxiety disorder, psychiatric disorder, you should check your thyroid. That's a must. Patients with dementia, memory problem, we always check thyroid. So thyroid is so important in categories of patients. So I would say your unexplained tiredness, you always check your thyroid. There are patients, certain predisposed patients. So patients, for instance, who have got autoimmune disease. I said the most common cause for high or low thyroid is autoimmune, where the body attacks the gland. Now, diabetes type 1 is an autoimmune disease. Vitiligo, when you have that skin condition, autoimmune. Pernicious anemia, autoimmune. So if you have a group of autoimmune disease, you're more prone to others as well. So I would want to check your thyroid. There are patients stroke patients, for instance, they can have an irregular heart rate that causes stroke. It's called atrial fibrillation. So if a doctor finds an irregular heart rate in you, you should have your thyroid checked if it is overactive, because overactive thyroid can cause irregular heart rhythm. Especially in the elderly patients. It's called atrial fibrillation. Yeah. Children who are not growing, we call it stunted growth or growth retardation. You would want to check their thyroid. You want to see, because it affects your metabolism. And if your metabolism is not working, of course, it will cause you growth retardation.
Yes.
And what else? There's a condition called carpal tunnel syndrome, where the nerve is trapped at the wrist. In those patients, they have pins and needles, or they have numbness in their hand. If you have a patient like that, please check their thyroid as well. So really, and also patients with high cholesterol. If you have low thyroid, it can cause high cholesterol. So not just only, yes, you've got a genetic high cholesterol, you want to make sure there's nothing else contributing to that. So these are the categories of patient I would want to check thyroid for.
All right.
But that's our thyroid in a nutshell.
Well, thank you so much, Doc. Viewers, I'm sure you'll find this information very, very important. Do share it with your family and friends, and even anyone who's suffering from thyroid situations, you can share this information with them also. So thank you so much for joining us. Continue to send in your questions, and we're going to be starting to answer your questions. Because we've had to switch platforms, the engagements are not there as yet. But thank you to our regular viewers who continue to follow us and continue to send in your questions. From us here at TBN, we want to say good night. And Dr. Saw, anything you want to say in closing?
Yes, again, thanks Akash and your team, and to the viewers, thanks for listening and watching the program.
All right, so remember to stay healthy and drive safe on our roadways. Have a